Okay, thank you, and good evening, members of council, staff, and we have one resident joining us. Welcome to the Otonabee-South Moncton Council meeting of September the 27th. The agenda is before you. Before we start, just a few housekeeping orders. Again, I'd remind participants, please keep themselves on mute unless they are speaking. And then, of course, you have to remember to take yourself off mute. If you have to leave the meeting for any reason at all, if you can advise the clerk via the chat line, just let her know you have to leave, and then she can always make sure that we can maintain quorum. I think that's about it. By now, we're getting used to this meeting format. Someday we might even get good at it. So we'll call our meeting to order at 6:01. The only announcement I think that I should make is I feel it's appropriate on behalf of council and the township to offer congratulations to Philip Lawrence on his success in the recent federal election. And I think if council agree, I should send him a congratulatory note on behalf of council and just express a keen interest in working with him for the next term, federal term, whatever that happens to be. But I think it's fair to say that we worked well with MP Lawrence during the last term, and I look forward to that continuing. So are there any disclosures of pecuniary interest on any of the matters that are before us tonight? Seeing no hands, we'll move down you've got the agenda before you that's been circulated for tonight's meeting. Are there any additions or deletions from this agenda? And seeing none, I'd like a motion, please, to adopt the agenda as circulated for tonight's meeting. You see Councillor Powers and Councillor Allen. All in favor? That's carried. Thank you. There are no minutes, council or board minutes to review. There are no delegations tonight. The first item that we'll deal with then is a staff report from Recreation Parks and Facilities to do with Stewart Hall Community Center and some new proposed rates. And I'll turn it over to Mike Nelson. Good evening, Mike.
Good evening, Mayor Taylor, council members, council. Hope everybody's doing well tonight. I'll be pretty brief with this one. It's not a very long report. I'm sure you guys have looked over it. And really, if you guys have any questions, just let me know. We took over running the facilities, our department there, back earlier in 2021 fully. And we just recently finalized taking over Stewart Hall Community Center from the committee that was taking care of it. And we obviously needed to set some rates that council was approved. We were right now, any rentals that were already ongoing, we're using the rates that were already there. As you see in the report, the 50 per day for OSM residents or 100 per day for non-residents. So which obviously we thought was a little on the low end. So obviously I think the prices are still pretty fair, but I believe the rates, but I'll definitely take council's input on that and see what everybody thinks about them.
Okay, thank you, Mike. So we'll open it up to members of council for discussion. Go ahead, Councillor Powers.
Thanks, Mayor Taylor. Mike, good report. Just the only question I have, I don't think I have any real concerns. Obviously, it's a bit of a jump, but to be fair, $50 a day is pretty cheap to rent a hall. And so I think $50 an hour is fairly reasonable for a hall such as that. The only question I had is the weekly rate. I'm trying to understand the weekly rate. It's $75 for the week, but $50 for an hour. Is that how I'm reading that?
No, actually, no. So weekly rental is like if you're, sorry, I should have worded that better. If you're doing it, if you're renting it every week, basically, if you're doing a weekly yoga class or something, and you're going to be renting it for at least 4 consecutive rentals, we'll give you a bit of a deal. If you're going to be basically continuously renting the facility, you basically get the nightly price for half price. We've got a couple classes there ongoing that, you know, even the 75, we don't know if they'll continue with, but at 150 a day, definitely weren't going to continue with. So tried to find a solution that could reasonably be that we still you know, pay for our cleaning services, pay for our staff to make it out there and back, and administrative duties while still making it affordable for somebody trying to run a class out of that hall or something similar to that.
Okay, all right. Yeah, I mean, I'm not sure if there's some additional clarity there, but yeah, I sort of read it as a weekly rate of $75, not as a ongoing, if you rent it for a week, ongoing, or 1 hour per week for 4 weeks kind of thing, you get it at $75 or something like that. So maybe just some clarity for folks that might be reading that as to how to interpret that,
Yeah.
just some thoughts. But other than that, I have no issues. Thanks, Mike.
Thanks, Calspar. I will do that because I was looking at it right before we started, and I noticed that too, that it could be definitely taken the way you viewed it. So I will clear that up on the rate sheet for sure.
Okay, thank you. Deputy Clerk, you had your hand up, Bonnie?
Yes, through the mayor to Mike, could you give me an overview of, you mentioned yoga classes there. Who is utilizing the community center?
Right now, I have somebody inquiring about a yoga class that would begin sometime in the fall. They said we sort of put it on hold until the rates got approved, but right now there is a karate class being run out of there on Monday evenings from a Martin. Well, I think he's related or something to the people who live right across the road from the Stewart Hall Community Center. I can't think of his last name off the top of my head, but he's the only regular renter we have right now. And then we have a baby shower scheduled for October 3rd, or a wedding shower, sorry, scheduled for October 3rd. And then otherwise, it seems to be like just talking to Mary Jane, who used to pretty much run the facility by herself the last year or two, by the sounds of it. It's a lot of local community members that use it for birthday parties, for showers. Nothing too crazy, obviously. They'd have to get the alcohol permit and everything else to do any alcohol events there, which I haven't quite decided. I briefly discussed it with Heather once, but whether we'd even want to do that, because as it is, it's going to be extremely hard for us to staff if there's an event there, even right now. So it's going to cause challenges in a lot of ways going forward, I think. So I definitely don't think we want to do alcohol events there, at least to start. So, but yeah, for the most part, Deputy Clerk, it's just local community members. You say classes, showers, stuff like that, birthdays.
Go ahead.
Just a follow-up question to Mike. Have you did like comparables, or just wondering how you arrived on these numbers? Did you do a comparable, for instance, in our community? I'm thinking of the Lions Club. They're comparable to their rates.
Yeah, actually, Deputy Clerk, I took a comparable of basically our small hall here, sort of, and what we have our prices set at, because it's a comparable size, and then also contacted Teddy's and with the Lions Club to see what they charge there. Their nightly rate is $150, but he said that they're finding that's too cheap for the amount of work that goes into a rental, so they're moving it up to $200 effective. They were having a meeting the other night to discuss it, and then they were also $50 per hour, minimum 2-hour rentals. So I went with very similar to what the Legion Lions Club is.
Okay, and I don't believe, Mike, there is other than, but it's volunteers, like it's different. The Lions is volunteers, and Valier's the same as volunteers. Our rates out there, even though it's a community. Yeah,
exactly. It makes it, people would love the rates to stay as low as they are, obviously, right now, but it's pretty tough when you've got staff cleaning it every week and going out there to let people in and maintaining it every time there's a toilet running. Mary Jane used to live right beside there. She would go over, and now one of our staff members running out there every time there's a very minor problem, even light bulbs out, so it's definitely warrants, I think, a raise in price. I don't think we have to go too high, but definitely up from what it was.
okay. Thank you, Mike, for the report and for all the work you've done in arriving at these numbers. So thank you.
Thank you, Deputy Clerk.
Okay, thank you, Councillor Howie. You got a question, Ken?
Yeah, through the mayor, just one question for Mike. Is the one-time user that we have, is he fine with the rate increase?
Good question, Councillor Howie. We discussed it a little bit. He would have liked it to stay. Actually, they're not even doing 30 or 50. They're actually getting it for I believe it comes to a total of $37 a night, and they use it from about 3 o'clock till 10 o'clock. So he didn't want it to go above $50 for him. Really, he said that'd be tough, but obviously, especially when you're using it from 3 o'clock till 10 o'clock, you know, it's just not feasible. Yes, you know, if we wanted to keep him, he is a very low maintenance renter, you know, and he was arguing that point, but we can't base the rates for everybody off of how the renter is. And you know, right now we're cleaning it once a week. Basically, you add another renter in, and we're cleaning it before and after that renter as well. So you've got those cleaning fees, and yeah, it makes it pretty tough when all the work goes into it. You can't really charge $50, make $50 a week off of a seven-hour rental. So and especially, like I said, a lot of other groups that rent it, it's going to be a lot more work when it comes to the cleanup and everything else that's involved. So I'm not honest. If I had to say whether he's going to continue to use it or not, Councillor Howie, I would say, like, based on talking to him, it's 50-50 in my mind. I imagine he was, you know, saying he might have to leave to try to really get us to keep the price down too, you know. I'm thinking, you know, it's going to be $5 extra per participant in his group is what I figured it cost. So I would see them staying, I think, just based on that. If he asked everybody, you know, can you pay $5 more per week? I wouldn't think that's a huge deal, but I really can't say for sure, Councillor Howie.
Yeah, thanks, Mike. Yeah, just, we don't want to lose anybody doing stuff in our community when it's you know, involving people in groups, but we also got to cover our costs, I think. So thanks, Mike.
No, you've heard me say it before. You've heard me say it before. The only real way to be fair is to be consistent. So whatever our rates are, we have to be consistent with them. Are there any other questions from members of council on this? Mike, I have one that's indirectly related. There was I believe the last remaining board member contacted the township a short while ago, requesting information and direction on the few remaining funds, a small reserve fund I think they had set up there. They were hoping to talk to the treasurer and you. Was there ever answers provided to that individual, and was that done?
As far as I know, that is done, Mayor Taylor. I spoke to Jocelyn about it right after, and then we spoke again briefly about a week later, and she said they had a meeting set up to transfer the funds. So I haven't checked in to ensure that was completed, but as far as I believe it has been completed and taken care of.
So perhaps could you just confirm that with Jocelyn sometime this week, just to make sure that loop is closed?
100%.
Okay.
I have been meaning to do that anyway. Yeah.
Thank you. Okay, Deputy Clerk, did you have your hand up? Go ahead, Bonnie.
Yes, I wasn't aware of any of this. Could you share with council the amount of the money that would be, I'm assuming, coming over to a reserve for this hall?
Well, I can't because I don't know what it is, but this individual is going to be discussing with staff and exactly how to manage that. So perhaps Mike can bring a report back in a subsequent meeting when this information is available. I don't know how much it was. It was never mentioned in the email.
Okay, I appreciate that. It would be nice if there's a bit of a cushion there, because these older buildings certainly take maintenance, and that would be well appreciated, well received.
Okay, so
I'm sorry, Mayor Taylor, I believe it's approximately $4,000, what she had told me near the beginning. So it will give us a little, that's what I plan on using it for, the surprises. As you say, a lot of our buildings, Villiers, Bailey Road, and Stewart Hall especially, are getting up there in age, and you know, there's stuff going every week there. So it's good to have a cushion, as you say, Deputy.
okay, council, if you're comfortable with the report and the approval, the recommended motion is there that council approve the Stewart Hall Community Center rental rates as presented. Is any member of council willing to make that motion? Councillor Powers and Deputy Clark. All in favor? That is carried. Thank you very much, Mike. And don't go too far, Mike, because next on the agenda, you're going to give us a verbal report on the recreational facility opening. And I understand that this is
You were muted at the end there, Mayor.
all right. I understand this is causing a lot of work for you and staff. So go ahead. Can you give us an update? Thanks, Mike.
Thanks, Mayor Taylor. Yeah, obviously, early August there, we were pretty hopeful we can get to the exit stage by early September, and things would become a bit easier around here and easier everywhere in the province, really. But that hasn't been the case, obviously. If anything, they're a bit tighter this year, especially on the regulations and protocols that are in place with the recent proof of vaccination coming into play. And but as far as the startup this year with the refrigeration plant, went fantastic, really. The new dehumidifier we have definitely really helped. It was a pretty warm week. Normally we get the humidity gets up to around 65, 70 during a week like that when you're trying to start up. And we like it maintained at about 45 during the year, and it didn't go above about 53 the whole spring. So we normally have a ton of drips on the ice with weather like that starting up, and we got 0 this year. So that was really good to deal with. Made painting the ice much easier as well. We had a lot of problems last year with painting, and the guys had a very easy time with it this year. And then as far as protocols go, we at least started out extremely similar to last year. How last year ended, I guess. We 1 spectator per participant. Contact tracing and screening were done basically the same ways last year, where the organization could choose whether to do it fully themselves and basically sign off that they were doing it themselves, or they could use our sign-in sheet on the way in along with our screening questions and do it that way. And then we also started out with the max 30 participants on ice. And that got changed to 40 on September 17th, I believe, after a meeting with Peterborough Public Health and Health Unit Rec Manager, or Peterborough Health Unit area rec managers. We did it last year as well, and we did it this year again. We have meetings before opening every couple of weeks just to make sure everybody's on the same page, and if we can have all of our facilities obviously open with at least similar protocols. Every facility is different, but if we could at least be working off the same major protocols, then it makes it a lot easier for especially our small town rink like ourselves that doesn't have a lot of room when the city of Peterborough is willing to make regressions so that, you know, we all don't take a lot of abuse. It helps a lot. And so the initial request to move to 40 actually went to the city of Peterborough, and they shared it with our group, and it was a request that came together basically from all the local or Peterborough Health Unit minor hockey programs and girls minor hockey programs. And because with the province basically allows full gameplay in their guidelines, full body contact, sit beside each other on the bench, but they still have to social distance in the dressing room. So that's why most facilities went with 30 as a capacity limit on ice, because it's very hard to put more than 30 people in the dressing rooms. As most of you know, we're using our hall as another dressing room area, our small hall area. So it fits 30 social distanced, and then the 4 dressing rooms combined fit 24 social distance. So we had our 30 on ice limit with some extra chairs if needed. But now with that request, we all decided to move up to 40. So we basically have some extra chairs out now, and we have basically 15 extra chairs if needed. And that was all to permit gameplay when that starts happening in mid-October, because the OMHA and all the other OWHA and all the other organizations basically opened up under the impression that it was a normal gameplay year. That's what they were told by the OHF. That's what the province, at least as far as on ice rules went. So the dressing room problem really hit them hard, I think. So, but getting up to 40, that should be enough. It'll be a little tight if all 18 kids on every team show up and, you know, all 5 coaches, but Otherwise, they should be good. In my opinion, you just drop a coach off the bench or send them into the crowd. So that shouldn't be a problem. And then obviously the proof of vaccination has been interesting. It came into effect through regulation 645/21 and came into effect on September 22nd. Originally, we were under the impression from Peterborough Public Health that it had to be our staff that was checking proof of vaccination at the door, which includes your vaccination slip saying that you have 2 doses and a valid piece of photo ID. So basically your driver's license. So we were preparing to have our staff do that, or possibly even have a security company come in and do that. And then we had one of our meetings just before it came into effect with Peterborough Public Health and all the other rec managers, where they clarified that we can have the organizations do it and just sign off that they are completing it, basically. So it was a question between, we pretty much would have had to have 4 staff on all the time to complete the sanitizing. I really didn't want one of our part-time staff doing the checking by themselves. Some people feel pretty strongly one way or the other about the vaccination policy in place by the province. And some people don't realize that the 20-year-old part-timer checking your ID isn't the one who made those rules. So so that was a big concern of mine. So I wanted at least 2 staff on to do that. And plus we would have need somebody on the Olympia at the same time, and also somebody doing the sanitizing in order to continue basically doing back-to-back rentals as we have, or have a very large gap in between rentals. So so we decided, like, as on that meeting, basically everybody said we'll all do it through the organizations. We'll have the organizations do it. Another benefit to that is it's a coach or manager parent that's doing it. And once they've done it once or twice, they've seen almost all the spectators. We're only allowing 1 spectator per participant right now. So they've basically seen everybody who's coming in. If you see a new face as you're checking everybody in for contact tracing, you make them show them their vaccination versus our staff, 5 different staff having to do it basically every night, because they're always switching in and out, and they're not going to remember every face they see every night. So we definitely thought that was the better way to do it. Took a lot of stress off our staff, that's for sure. I was extremely worried about our part-time staff having to do that. So but otherwise everything with it for the most part has gone very well. We've had a few people that we've actually caught sneaking in. There may be a few that have slipped by and that we didn't notice or get. But the way we're doing it basically right now is we have a form we've had every organization assign a representative basically to each team to do the contact tracing, screening, and proof of vaccination check. And then before anybody comes in the building, that representative has to come in to the front foyer. They basically write down their organization name, check mark screening completed, contact tracing completed, proof of vaccination completed, and then they initial or they print their name and initial to show who did that check. So that's our way of getting them to sign that it's been completed. And then we have the representative stay there at the door as every person, including parents, come in with that group to ensure that no one that was hiding in their car, basically sitting out there waiting for things to clear out and then come in. So it's worked pretty well so far. Like I said, there's been a couple times where one of our staff members had to do something and the representative left the door, and they look back and 3 people were trying to sneak in, and he asked them for proof of vaccination and none of them had it. So there definitely is a bit of that going on, but I think at least from our side of it, by having them sign in when they come in the door, we're putting it on the organizations that they're responsible. And I know at least from talking with all the users, they're very serious. Councillor Allen, do you have a question?
No, sorry, Mike, that's my line. Councillor Allen, do you have a question?
Well, I was waiting for that, Mayor Taylor. But
Are you-
thank you for addressing me, Mike.
Yeah.
And I do, and I'm not trying to cut you off. I was just trying to make sure I was in line. So if you needed to finish that, you can go ahead and do so. I guess, but quickly, my question just goes around, and it is the discussion, because when we last spoke, we spoke about possibility of having, private security or such look after this requirement for our, I think especially our arena. I think it's probably one of the only regular publicly accessed venues that we have that would be deemed non-essential. I guess, Mike, and it may be Greg that can answer as well, but around liability, incurred liability, like the liability that goes with having, a volunteer organization sign off on this. I mean, I think ultimately, if we get to the point in time where enforcement is being completed, I'm just wondering around that, as far as who is the actual responsible. My understanding was the owner of the facility, the operator of the facility, and I didn't know how having someone else do this work on our behalf kind of plays into that, especially being a volunteer organization, or if there was any concerns, or that may be, you may have an answer for that. So that's my question. Thank you.
Yeah, Councillor Allen, that's a good question. In my conversations with Peterborough Public Health, they have said that basically, if we're getting them to write down their contact info or their name and who they're with, what organization, what time, they can figure out who they are and how to contact them. And if there is a case where they find out somebody had caught the virus, they were in our facility without being vaccinated, basically, if at worst, they're going to call us and ask us if we have the contact information for that person. That's the gist I got anyways. They told me straight up they're not looking to hand out tickets, and at least at this time, they laughed and said we're way too busy to even think about doing an investigation and giving people tickets. So I'm not too concerned about it in that regard, but I was concerned how seriously the organizations would take it and whether, but basically it's in their contracts that if they knowingly let somebody in without their proof of vaccination, their ice we can take their ice from them basically on the spot, and their contract is nulled. So, and I've told every head of user group that if we find out they're letting people in unvaccinated, we will take their ice from them on the spot, that they knowingly let people in unvaccinated. It's a liability for us and it's a liability for them, and their ice will be nulled for the year, and we will find somebody else to take that ice basically. So I think especially whoever's leading each user group, at least here, I know, they love being at the arena. That's why they put the time into volunteering that they do, and they love playing. And basically the gist I've got from everybody is, Mike, we're not gonna risk our ice with the arena just to get one guy in who doesn't want to get vaccinated, or one spectator in that doesn't want to get vaccinated. So honestly, Councillor Allen, until it actually happens, I can't say for sure what would happen in that scenario, but I think we're about as covered as we can be without having our staff, which barring getting a security company, as we had talked about before. I think that's really the only way we could go about it and be more covered legally than we are right now.
Okay.
Greg, did you want to supplement something?
Sure, I can deal with some of the other liability pieces. So each of the organizations, so whether it's Ontario Minor Hockey Association or the Ontario Women's Hockey Association, they have blanket liability coverage for their teams, and a policy with respect to that. So sort of before COVID, so BC was somebody would have gotten hurt in a facility, would have if there would have been some sort of a statement of claim that would have come back to the municipality. Their policy covers it, and it's a part of our contract that their organizations have to have liability insurance. And so they're covered in that particular regard. So if something did happen in the facility, typically we would be named. We would be named in any statement of claim. The other aspect of it is that for those groups that are non-organized groups, I know Mike, you guys have, they can purchase as a part of their rental insurance coverage that's a part of their contract. So that's how we sort of deal with it from both what I would call sort of larger organizations, and then how we would sort of deal with individuals on an individual rentals, like a men's hockey league or something like that. So, Mr. Mayor, if there's any other questions, I'd be certainly pleased to answer them.
Just,
Okay, Mark.
just finish.
follow-up?
I'll just finish it up and follow up, and which I understand. And thanks, Greg, for that answer. I think I was more inclined to was thinking of the actual, the fine that goes along with potentially allowing people in that are unvaccinated. It sounds like it's pretty much in control. And you know what? I think for the most part, even, the folks that aren't vaccinated know the rules, and probably for the most part, other than maybe the 3 that Mike found the other day, are following those rules and respecting the provincial legislation. So I think that answers the question. I guess my concern really was only if you had, folks at a volunteer stand, somehow people are slipping past, if truly, if we got to enforcement level, if that would still be brought back against the township, which maybe it would be, but I think, there's a fairly good safeguard in your volunteer organizations, and it sounds as if they're doing their due diligence for us at this point in time. And I guess if Mike sees any reason not to think that, we can revisit it at that time.
Okay, before I thank you, Councilor Arnold, before I move on to other questions, Mike, were you finished your verbal update on the rec facility opening?
Yeah, it was basically the proof of vaccination piece, Mayor Taylor, and then we were wrapping up, and I was getting to the end there. So I might have rambled on about nothing for 2 minutes, but no, I got what I wanted to say out.
Okay, I just wanted to make sure that you had provided all the information that you wanted to. I know Deputy Clerk had a question. Go ahead, Bonnie.
Yes, through you. Just so a couple of things. We all are aware, you can go in and have your double vaccination, and remember, it's just the last piece of paper with the second one on. You don't need to carry all that around till they get the app. But, we can still have people that come down positive, and that's why the tracking piece is so important when people come through the arena, in case a person who is vaccinated happens to come down positive. The other thing is, Mike, are you aware if anyone is using, it's a printable form. I've used it a couple of times through the health unit. One was for a board meeting, and one was for Dr. Salvatierra's going away party, and you can do the screening basically online with the government, and then it prints it out. It has to be done within, I want to say, 24 hours. It gives you a time frame that you can enter a facility because you have done the screening. It really makes it easy for people at the door. Are they using that, or are you aware of that?
Yeah, Deputy Clerk, I know at least some of them are using that specific one probably, or something very similar. Easton's, my son's team, we use one that actually gets sent straight to the manager as soon as we fill it out. So she gets an email every time one of us fills it out. I think the Wolverines are using something similar. Councillor Powers might know better about minor hockey than I do, but but you basically follow a link on the Otonabee website, Otonabee Wolves website, you fill it out, gives you a check mark, and you show it to the coach upon entry to the arena for them as well. So it's everybody seems to use something similar to that, Deputy Clerk.
Thank you. I was thinking through the mayor to Mike, I was thinking about actually the people coming in at the door. So visitors, I know it's just one now, and likely parents which have that access to forward the link to the team. Just in future, if it opens up, or say a grandparent happened to be bringing a child or something, so it's pretty slick. I thought it was just
Yeah.
a super way to do it. Takes less
Yeah.
time too when you hand the paper at the door.
Actually, Deputy Clark, that's the same spectators, parents, whether it's grandparent, parent, they're all expected to do it the same way the kids are. It's, like I said, myself and my wife had to do it the other day. You just follow the link on the website. Every parent gets the email showing the link. So if my dad's going to bring Easton or Luke to minor hockey, even I sent him the link for the first one, and now he knows where to go. So yeah, the parents and grandparents, they're expected to do it the same way. And like you said, it's very simple and very easy.
Yeah.
If you can't take the 30 seconds to do it, then
It's gonna take-
you should
it's
stay
gonna-
inside.
It's going to take more than 30 seconds at the door, so far more
Yeah,
convenient.
Exactly, yeah. So it's much easier actually than people coming in. That's what I said to the organizations, that the way you're doing it with us right now, you're coming in and you're technically supposed to be reading this whole page before you sign, and then the next person does it and the next person does it. So
Yeah.
So doing it that way through the organizations, it's much easier for everybody, I think.
Thank you.
Okay, thank you, Mike. Are there any other questions from members of council on the facilities opening update? Go ahead, Councillor Howie.
Yeah, through the mayor. Yeah, thanks for the update there, Mike. It sounds like you've been doing a lot of work to try and keep everything safe. And, one of the questions I got, I guess, which wasn't really explained yet, is when we do any of the rentals of the rooms and stuff like that, is there something put in place that they have to do their own checking, or do we have to have somebody there?
No, Councillor Howie, it's basically, right now, it's the same thing. We're, because we're not allowing members of the general public into the building right now. Obviously, if you ask to use the bathroom, we do have a contact tracing form, or for contractors, we have our own forms if needed. But generally, if anybody's renting it, say for a birthday party or something, it's the same agreement that minor hockey and anybody else has to sign. They have to provide me with a safety plan saying exactly how their screening is going to be completed, their contact tracing, and their proof of vaccination will be completed. And that they're doing it, that they're keeping those records for a minimum of 30 days, obviously except for the proof of vaccination, but the contact tracing and screening records are supposed to be kept for minimum 30 days. So basically anybody renting our facility right now, doesn't matter whether it's a hall or the ice or whatever, is sending a safety plan with that information, or they're not renting the facility.
No, great. Sounds like you got it under control. Just as a follow-up, I guess it might be more to Greg. If we have to get to a point where we do have to have security, is that covered under any of the funding that we got for COVID?
Mr. Mayor, through to Councillor Howie, we could utilize some of those funds for that. So we have Mike and I and Heather and our treasurer have had a conversation about how do we apply, and what are some potential allocations for 2021 for that funding. So that could be the case for us to get access to do that. Mike's group has really done a great job in coming up with a solution, and it's a solution that doesn't really matter what rink you enter in Peterborough County. So I've got to give a lot of credit back to that group, to Peterborough Public Health. One of the things that Mike I didn't mention was they open up the doors to come into the facility 10 or 15 minutes before the ice time takes place, so that people and the participants and coaches are told to show up at that particular time and make it happen really quickly. So we're working on that. And then the same thing happens afterwards. They've got 10 minutes to get out and get out of the facility. And that allows us to keep the hourly schedules in place, and allows us to resurface the ice. Also allows us to disinfect those particular areas that need to be disinfected. And so Mike and his gang have really worked as a well-oiled machine to get everybody in and out and keep people relatively happy, and the focus being on the kids and the participants using the facility to enjoy and laugh and have a great time on there. So that's been our focus. So he's done a really great job.
Okay, thank you. I do want to move on. We've spent a lot of time on this. Deputy Clark, you have one more quick question?
Yes, just a quick question. And I'm assuming that, and it's just around the safety side through the mayor. So we let people in, then I'm assuming that the doors then close for the hockey game. If there was an emergency, is it a one-way system that people inside could go out without unlocking, but the outside people can't come in, just around that safety side?
Yeah, Deputy Clerk, we have separate entrances for basically everybody using, or entrances and exits. Everybody uses the same entrance, but once you're in on the ice, you go out, you're in the dressing rooms or the hall. So you use whichever exit door you're in. If you're in the hall, you use the exit door. If you're in the dressing room, you use that. And spectators all exit out the east side exit doors by the bleachers. Not sure if that answers your question, but
it doesn't, Mike. It's just if the doors are not accessible after a certain period of time, we've got the people in.
Yeah.
So then I'm assuming that anyone outside can't get in. It's locked because no one is there checking. If an emergency come up and people had to expediently get out, is that accessibility? Do they have to unlock before they get out the door to the parking lot? It's just an automatic, it's open from the inside out.
yeah, only locks from the outside.
Yeah, that's fine. That's all. Thank you.
Right, and there's panic fire hardware on all the doors, so.
Yeah, this whole arrangement would have to have been reviewed and approved by our fire chief as part of the emergency plan for the rec center. Okay, council and Mike, thank you very much. I guess as you expected, there's a great deal of interest among members of council on our rec facility and the opening and all the challenges that go along with that, and not the least of which is weather. We've had some warm weather lately, and the new compressors that we put in a few years ago are really paying off, I think. So thank you for that. I guess at this point in time, council, I'd just like a motion, please, to receive the verbal update from our Parks and Facilities Manager on the opening. I see Councillor Howie and Deputy Clerk. All in favor? That's received. Thank you very much, Mike. And that verbal update, council, I would suggest is a great segue into our next agenda item. We're going to move down now to 11.1, which is an OSM mandatory COVID-19 vaccination policy. And I think, Greg, should I turn it over to you to review this with council?
Yes, Mr. Mayor, and I think there'll probably be some contributions from Heather and probably from Mike in this particular one too, as we and then as well from Councillor Powers and yourself being part of the personnel committee. So this report as presented is with a recommendation from the Personnel and Finance Committee recommending approval of our personnel policy 8.3, which is a mandatory COVID vaccination policy. In the package that was circulated to council, there was a copy of the report. There was also a copy of the recent county policy that was passed and put into effect last Wednesday. And there was also a copy of a formal recommendation from Peterborough Public Health dated the 9th of September that was provided to employers across Peterborough County with their specific recommendation that all the workplaces in the city and the county that their policies include a requirement for employees to receive vaccine unless otherwise medically exempt. So there's a lot of information that's here. And as far as the policy is concerned, so our policy has been drafted by our solicitor, in this particular case, Beth Trainer, who is with Systems. So we were able to provide a draft copy and a final copy of the Peterborough County policy that it was approved by County Council to the solicitor. And this particular draft policy that you see here is a result of that particular work done by the staff And then as well, the committee, the Personnel and Finance Committee met last week on Tuesday, the 21st, and reviewed the draft policy and had a significant conversation about the draft policy. And resulting from that particular conversation was the recommendation that council sees here this evening. So as I said, the policy follows very similar to the county policy. We're looking for a full mandatory vaccination of our staff, with the accommodations being put in place for the potential for specific medical exemptions and religious exemptions as far as that is concerned as well. So that is contemplated in the policy. Mr. Mayor, I'll turn it back to you because I know that there may be specific questions related to the policy and the documents that are here. And I know that Mr. Mayor and Councillor Powers, as members of the committee, may have some additional, and Heather as well, some additional comments related to the report and the policies that are being presented.
Okay, thank you, Greg. Nick, as Chair of Personnel, Finance and Personnel, do you have anything you'd like to add to Greg's comments there?
I think that, Greg summarized it well in terms of the position and how this policy came to where it is today and how it's being presented to us this evening. I think ultimately it's a difficult decision. It is one that, we don't come to lightly, and the Personnel Committee certainly didn't come to lightly. It is a policy that ultimately the Personnel Committee and staff felt strongly that we needed to implement. I think that there are some discussion items that we could bring up during our conversation here, but I think ultimately the appropriate approach for us moving forward is to implement a mandatory vaccination policy this evening. I think that's the prudent approach. The semantics of it and the pieces I think will be ironed out during our conversation, but ultimately I think that's where we landed. Those are my opening comments.
Thank you very much. Okay, well, we'll open up now to questions and comments, and I expect that this will be met with vigorous discussion. Go ahead, Deputy Clerk.
Yes, through the mayor. It is a difficult decision, but we're here for the protection of the public. It is a non-essential uses that we are looking at here. I would ask through the mayor to Greg to comment. Greg and I had a conversation today just around the Human Rights Commission that come out, and also just in reassuring council here that this policy has been vetted through our solicitor, and the county's policy has been vetted through a different firm. So we have a couple of legal opinions, certainly because we don't want to be in a liability position, could be in a challenge position, but that goes with any situation. So Greg, could you just comment on those things? I think that is certainly all council should be aware of. Thank you. Thank you.
Mr. Mayor, through the Deputy Mayor, thank you, Deputy Mayor. Yes, there was things have moved along quite rapidly, and based on the last couple of weeks. So really the driver for this was the move by the province, and they're, as Mike had mentioned before, OREG 64521, and which sets out provisions for requiring for proof of vaccinations. And that's what really drove this particular thing, along with the formal recommendation coming from Peterborough Public Health. So as I mentioned in my opening, our policy has been drafted by our solicitor, and our solicitor is Beth Trainer, and she's with Systems. And I mentioned in the opening, there was a review of the county's draft, or the county's policy, which had been approved. And I understand in the presentation that did occur at County Council, I believe that the CAO for the county had advised council that had been reviewed by Aird & Barilus, I believe, and it was the law firm that looked at the county's particular policy, and that county policy is also in effect in other jurisdictions such as Hastings County. So what has occurred since the county has passed their particular policy? On last Thursday, so it would have been the day after the county council meeting, there were two pieces of documentation that were released. One of them was from the Ontario Human Rights Commission and around the Human Rights Code, and they issued a bulletin. And the bulletin, what it did was meant to be sort of a preemptive legal brief that talks about what would occur, or how the Human Rights Commission would deal with any complaints made before the commission related to mandatory vaccinations and proof of vaccinations. And so they gave a couple of, and I'll just sort of give you a précis. The précis is that they've said that that the proof of vaccinations and the request for proof of vaccinations and the requirement in workplaces is permissible under the code, under the Human Rights Code. So because of the pandemic, it made it permissible under the code. So because it is deemed to be permissible, that an individual could not claim that that their rights have been violated as a response, as a part of their belief system that said that they just didn't generally believe that they could be that their rights would be not taken into consideration if there was a mandatory vaccination requirement. So that's what the Human Rights Commission said. They also said that related to a person's claim around creed. And the creed deals specifically with just a general statement that says, because of my creed, because of this particular religious conviction or a different type of conviction, that wouldn't be an automatic as well. And so that they would be looking at specific religious types of requests for exemption. And so that bulletin, the Human Rights Commission does not issue bulletins proactively like this very often. So they knew it was going to be a big matter where they were going to see potentially they were going to see complaints made to the commission. So in our particular policy that we're promoting, the county policy, is that someone could not, we would not be in a situation where we would be infringing upon a person's individual rights and beliefs if we implemented this particular proof of vaccination mandate, and that they thought it was permissible because of the pandemic. The second piece that was issued last week was a directive from the Ministry of Health that went to physicians through the Ontario College of Physicians and Surgeons. And what they've said in this particular case is they've given direction to physicians about how they should view medical requests for medical exemptions. And so that gives some clarity. There's only one or two that in their minds would satisfy an exemption. And I know that there was I'm not sure the technical term, but an enlargement of the heart and a few of the other. There's two pieces that were deemed to be proof of exemption. The second piece, which would have been or the third piece, which would have been allergies, they've put in place, and they're recommending that physicians follow a protocol that if somebody comes and claims that there's an allergic, unless there was a specific allergic reaction as a result of them receiving a vaccination, which wouldn't allow them like subsequent vaccinations, that they're recommending that the individuals would be referred to by their physician to a allergy specialist who would then take them through the allergy protocols and then, so on and so forth through that testing regime. So those two items have been have been made public for the purposes of supporting these particular types of policies. And so we have had an opportunity to review those with our solicitor as well, to make sure that they were aware of that, and they were. And so the policy that you have for us is sort of what I would sort of classify as based on information here today on the 27th of September at 5 to 7 would be probably the most up-to-date type of policy, taking in all those other considerations that I just spoke of, based on these new statements from these organizations that do play a role from a legal review perspective. So hopefully, Deputy Mayor, that answers some of your questions.
Follow up, Bonnie?
Yes, just a follow up, and to that, and through the mayor, and the mayor did speak of consistency, and it's consistency everywhere. And certainly we're aware of the fact that we're asking people at the door for their verification of vaccination. How can we then not ask that from everyone that's going to be in contact? So I think the consistency piece is also quite pertinent.
Very good, thank you. Okay, any other questions or comments on this? Councilor Allen, go ahead, Mark.
Sorry, folks, I gotta find that mute button. Thanks, Mayor Taylor. And again, as it's been stated, but I look at this policy that is in draft form and is before us tonight. And it's one that I feel, obviously, it could bring very serious repercussions to our staff or volunteers or potentially council. So I want to think hard and seriously about it while we have this discussion tonight. And I hope council will take into consideration some of the points that I may have. We're talking about staff that could have worked many years for us here at the township, and who have done almost everything asked of them over the last couple of years in some pretty difficult, challenging times, where they may have made their kitchen into an office, a makeshift office to be able to continue to function and get the township business completed. So in appreciation of those staff, I do want to ask a few of these questions. I have a few questions, and I also have a few sort of nuances that would be more timely in discussion of just tidying up the policy when it gets to that. So I think I'd ask with the questions first. But first, I'd like to make a note, and I do ask the clerk to note this. I would like, when this comes to a vote, I would like that it be recorded, and I just didn't want to lose track of that. Greg asked, you kind of answered the question around the vetting through the legal, and I was just going to ask where that was and that it had been done. I presume that it had, possibly with a few. I have 2 or 3 other questions that you may be able to sort of utilize those comments in the opinion of our legal team in answering these questions. So one of them was there consideration, and I'm sure there was, to rapid antigen testing, similar to many other municipalities that are implementing mandatory vaccine policies. Some of these are, large cities and regions, Mississauga, Brampton, Oakville, Peel region, along with the entire Ontario public sector. There are provisions around rapid antigen testing. So I don't know how or if our team looked at that, or what the legal response was to that. Additional, I'll get on my questions.
Mark, perhaps we could just do the questions one at a time. So let's get the answer.
Sure.
Let's do the answer to that one first.
Sure.
Thank you, Mr. Mayor, and through to Councillor Allen. So yes, as a part of this actual policy, there is there would be a utilization of the antigen testing. So if you read the policy, it says that we want to have proof of vaccination by the 1st of October, and then proof of full vaccination by the 1st of November. So what would happen is, as people go through the vaccination process, so we're going to have a group of individuals that would provide us with proof of vaccination, and they'll give us 2 doses by the 1st of October. There may be some people that might just have a dose and are going to plan on getting a 2nd dose in that time period. So in the policy, it says that we would be doing rapid testing of those individuals on twice a week on a Monday and Thursday, and we would use the antigen testing. Those testing kits are available through Peterborough Chamber of Commerce. They are, at the present time, there is no charge to us as an employer, so they're being made aware to all employers, made available to all employers. And so that we would go through a process, and we would have what we call a centralized testing, and it would happen with a couple of designated senior members of staff that would put those particular tests and conduct those tests on the Mondays and Thursdays until the individual hits the fully vaccinated designation on or before the 1st of November. So we are using the antigen testing as a part of our safety screening until the individual becomes fully vaccinated on or before the 1st of November.
Right. And further to that, I mean, which I read in the policy, and I understand that clearly. What I was asking for was there consideration for those folks that decide against vaccination at this point in time, like these other agencies have done. They've made provisions to allow for that for whatever reason, that where an exemption isn't available to them, but there is a true hesitancy in these people who are unsure at this time about the vaccine, and that is a real thing at this point.
Mr. Mayor, yes, it is a real thing, and so our policy is supports the Peterborough Public Health's mandate of full vaccination. So we want to try and have full vaccination. We know. So the second utilization would be for the antigen tests is for those individuals that might have a medical exemption or might have a religious exemption. Then we would utilize and that they have been approved and reviewed and are acceptable, that they would be our methodology for managing the safety of all the employees would be the utilization of the antigen testing for those individuals that have gone through the approved exemption process. And so that would meet the accommodations requirements of the Occupational Health and Safety Act, and as well the legal provisions for us to accommodate staff. But our goal is to support public health and the province to promote full vaccination as much as possible for those people that are medically able to be vaccinated.
Mark, you had a series of questions. Can you?
I do. I can move along. I mean,
Okay.
I understand what our policy reads. I'm not sure that's the answer I was looking for as far as what has been done to consider those who were chosen not to be vaccinated. But I guess this could go with it at this point in time. If we consider 20% of our staff, if we're somewhere in line with provincial averages, I was wondering what the potential liability for the township in the sense of loss of employees and or severance might cost as we move our way through this policy.
Mr. Mayor, we want to, I guess what we've been focusing on is trying to get as many people vaccinated as possible. We have had some conversations with respect to the ongoing and a long-term liability. We would have met our conditions, legal conditions about both from an accommodations perspective and a human rights perspective by us going forward. So as I said, our goal is to try and have as many people as vaccinated as possible, which is the directive that we've received from Peterborough Public Health and the province of Ontario, and we would be hoping that we would be able to accommodate all of our staff with this particular policy as it's being presented.
Just follow up on that, which I understand, and I understand the goals, but having said that, we haven't provided any options for those folks that choose not to go down that path. So what I'm asking is, at the beginning of November, could it be potential that we lose staff in, for example, and I'm only using it as an example, a public works department that has a snowstorm on November 1st, and I'm just looking for the number of staff potentially that this could affect, like how many, if we're considering 20% as a provincial average. I don't know if we're above or below that, but I was just putting that out there as a number. Is there an exact number or close to a number of staff that we potentially could see?
I wouldn't be having that conversation publicly. Certainly, if we were going to have it, it would be a conversation as far as the in the camera closed session type of thing. We've not looked at we have looked at it, but I guess, as I said, we're looking to go this, and your question was, could we get to November 1st and we might be in a position where the way the policy reads, that we would have to terminate a member of our staff because there was non-compliance with the policy, and the answer is yes.
And as many staff as possibly aren't vaccinated at the time. Okay. I guess some of my other questions are more, in specific with regard to the nuances of the policy, and I can speak to them now. It's just in consideration of the policy as written, and Greg made comment on it, and it kind of goes in line. So when I read the County of Peterborough's policy, it said item on page 5 of 5, item 5, just quickly, it may result in termination, and there was some other verbiage around the CAO and in determining that, whereas ours took a bit harder line as far as it said they will be terminated. So I was just wondering around that. It seems a little bit harder line, although has essentially the same effect, other than as we move forward, I think everybody recognizes a fairly fluid situation, and as people, the requirement for vaccines for employment increase. My concern is around, if something changes in the vaccine regime, where as far as availabilities and stuff like that, it just doesn't leave a lot of room for, consideration of whatever happens over the next couple of weeks. That's what I'm saying.
Mr. Mayor, that's an excellent question, and I can respond to that. We have had that conversation and had that conversation with Peterborough Public Health. So one of the items that we would be providing to all employees is Peterborough Public Health have a vaccination clinic calendar. There are vaccination clinics, and I know Deputy Mayor, you guys have been speaking to this since you're on the public health board. There are vaccination clinics every day now in different locations and at different times around the county. So they are looking at that, and they are not appointment, they are walk-in clinics. And in those particular cases, so the other question that was asked is, maybe I want a particular type of vaccine. Maybe I want a Pfizer, maybe I want a Moderna. In all of those particular clinics, we have been assured, and they're it's being advertised that way by Peterborough Public Health, that the vaccine of choice would be available at all of those particular clinics. So we've looked at that, and we've made arrangements to have that particular conversation. So, and we will be sharing that clinic schedule with all of our staff in order for them to be proactive to get to those particular areas, because there's two, on the Pfizer side and on the Moderna side. So Pfizer, there's a 21-day period between shots, and Moderna is 28 days. And so we can go through the process. Vaccination passports were made requirement as of the 22nd of September, so people have an idea about that. And so we do have enough time. If somebody does not have, if council is going to pass this particular policy tonight, we do have enough time to allow an unvaccinated person as of today to have 2 shots of vaccine within the prescribed 21 or 28 day period between now and the 1st of November.
Further to that, Greg, and you kind of touched on it, and it was one of my questions was around timing, because I did, Moderna is probably the longest at 28 and Pfizer's 21. I think the policy does read as such that they have to have 2 vaccines. It does not say that they have to be considered fully vaccinated by November 1st. So I do understand where that's coming from. I do have some hesitancy around the timing. It is extremely tight. I mean, there's no question about it. 28-day period. You know, the time people digest this and take it in, it's not giving them much time. I would like to know what council, the rest of council, thinks about the timing, if it could use a slight adjustment as they move forward with this policy. So that takes care of one of those. And then simply, in the sense, and you may have touched on it too, how does this HR policy apply to those who, you know, aren't employees in the sense, that being council? It's not just this council, but we're headed into another term of council. So we're essentially creating policy that those councillors may have to live by. So that and volunteers, is it simply a vaccine passport type idea?
Yes.
That's
So
how
they would have to, so Mr. Mayor, through to the Councillor Allen. So if we have so for instance, the Recreation Committee, which is a committee of council, would have to be a requirement to provide us with proof of vaccination. You know, we may have other, so as you stated, members of council, we're asking council to provide us with mandatory proof of vaccination. So similar to the county and how the county's doing it. So the county has included volunteers, they've included members of council, they've included staff, so part-time, full-time, they've included contractors, which is in ours as well. And we refer to them all as, in the definition section, as workers, including the volunteer firefighters. And all are covered by that particular worker designation.
And one last point, if I may, before I turn it over to someone else, hopefully. There was just and it's a small nuance, but I would like council to consider this. Within the policy, I think it says it will, and it's probably similar to other policies where it says this policy will be reviewed from time to time and such. I think in essence of what this policy means and what it does, I think it's prudent that we have that you know, a review period of at least an annual review period. I don't know if that's a fair assessment for timing, but I just would like to see if the council moves forward with this, that they include something that's a little more time sensitive rather than just having it out there and reviewing from time to time. So with that, I can leave that. Those are my questions and comments for now. I may have more as we work our way through this discussion, but I do thank you, Craig and Mayor Taylor, for your attention to my concerns and my questions I have at this time.
Okay, thank you, Councilor Adams. We certainly understand that this is a very difficult decision. It's a complicated issue. And certainly as chair of this meeting, I am prepared to show discretion and allow members of council time to voice their concerns and get their questions answered. And that's what I've done with you, Mark, and there may be other questions as we go forward, but I mean, I'm going to try and find that balance between allowing everybody the opportunity to express themselves and not starting to go around in circles. Going down now to Councilor Powers, I saw your hand up. Nick, go ahead.
Thanks, Mayor Taylor. Just a couple of semantic points, maybe some additional questions to Greg. Outside contractors. So I know contractors are covered. What about those contractors that are not actually entering into any facility? So I'm thinking maybe a roads department where we've hired some folks outside that are running trucks. Are we expecting those as well?
Mr. Mayor, through to Councilor Powers, we would expect any contractor. So because those contractors that are out doing road work are working with our employees. They're having contact with our employees. So our expectation would be that if you are a contractor and you're going to be providing service to this municipality, whether you're an IT contractor or a road contractor, that you are going to, and you're going to provide services either within our buildings or working alongside our staff, that you would provide us proof that the individuals that you're going to send to us as far as those employees will be vaccinated. And I know that the county has a form and that they have for specifically for contractors. So our goal was to have a similar form that would be put in place for the attestation that be signed by contractors doing work for the municipality.
Right, and I think just speaking, I think that probably simplifies the process a little bit in terms of, well, this one might not come in a building, this one might come in a building, this one should get a test, this one shouldn't, or, you know, prove, or this one should. I think it just simplifies it. If I can, the item H, where's that here? So item H, it says workers are prohibited from meeting indoors for business reasons with unvaccinated members of the public. That's fine. I'm okay to that point. It's the second sentence that I'm a little bit hesitant on, which states prior to scheduling meetings, I'm assuming with the public, workers must make inquiries of all participants to establish whether they require masks or distancing. So that implies that if a member of the staff was to be meeting with the public, they would be asking for their vaccination status prior to meeting them, is how I'm interpreting that. And I'm not sure if that's something I'd be comfortable with as a staff member, or if that's something I'd almost rather us say that you know, staff meeting indoors for business purposes with the public must wear masks and social distance unless all participants are fully vaccinated. It's the same, saying the same thing, but it's not implying that staff have to ask every single person that comes to meet them in public whether or not they're fully vaccinated. Because I'm just not sure that that's appropriate for staff, for an individual to walk into to a building and before they talk to them say, are you fully vaccinated, before I can talk with you. So I think it's just make the assumption that they are not, wear the mask, social distance, and then you don't get into the potential. And why I'm presenting this is I'm trying to avoid potential conflicts with staff in the future, because this is where this, I think, could come up if someone starts asking questions.
Mr. Mayor, through the Council Power. So what this H is meant to represent is around, as it states, meetings in indoor premises. And so we not only do we have a we would have a mandatory vaccination policy. So it means that those individuals coming onto our premises would have to be in advance asked around proof of vaccination. But they also have to meet our council recalls. We have a mandatory masking policy here as well that's currently in place, and so they would have to meet that particular requirement for physical distancing and masking. So I give you an example. So let's say we had a meeting with our planning consultant, and we were going to have a meeting in one of our rooms. My expectation and the expectation would be that, first of all, we would suggest that they, in our current environment, that we try and have it done virtually, okay? And then secondarily, if it had to be a face-to-face meeting, that our staff could ask for, because we have a mandatory mask requirement. It's very similar to contractors and everything, that you have to provide proof of vaccination in order for that meeting to occur. And then as well, you would have to take the various precautions related to the Occupational Health and Safety Act around masking, PPE, and physical distancing. So there's a couple of levels there, Councillor Powers, and I think that it would be somewhat, there would be a conflicting policy if we asked contractors to have a certain standard and we had other individuals that we were going to hold them to a different standard. So we want to hold everybody to the same standard. And so I think that might answer your question based on your query that you just posted to us.
Yeah. I'm thinking of the staff and trying to avoid potential conflicts, because I can see that there could be where there's in an impromptu meeting. And so, but in any case, if we're feeling that that's comfortable, we don't expect that, or where we're feeling comfortable, and I can appreciate keeping that same message across all of our interactions. I can appreciate that. Okay, last two comments really, which is I would tend to agree with the timeframes. I know, Greg, you and I have had some conversations on the timeframes. I am all for, if we're going to implement this, implement it sooner rather than later. I would prefer to give folks at least 7 days to get to their first dose. So rather than the 1st, I'd like to give them a full week to get that first dose. So bump it to the 6th and make it 6 and 6, no, October 6th, November 6th. I just want to be fair to staff. This is a change for some staff who are not there yet and are going to need to digest it. And I recognize that it can be available at any time on any day, but I think 1 week is certainly fair, but it's still very quick turnaround to get that first dose confirmation. So I'll just throw that out there to staff. I would like to see a 1 week time frame versus 4 days. Yeah, I think that's it for now. Thanks.
Okay, thank you. When we get close to considering motions, Councillor Powers, I'll consider that in the form of any motion and approval.
Mr. Mayor, I wonder if I could offer a comment to Councillor Powers about that.
Sure, go ahead.
Thank you, Mr. Mayor. So what we wanted, as we said at the beginning, is that the proof of vaccinations have been here since the 22nd of September. And so they would have had to, for anything, make arrangements for to get themselves ready for the proof of vaccination. So if that had not been the case, I would agree with the 6 and 6. It's not really, we're recommending the 1st and 1st so that we could be consistent with the county's approach to this as well. And so I know that we're a couple of days difference in dates from the county, but I think consistency is important and certainly would be something that we could represent based on that September the 22nd proof of vaccination, that requirement that has been. That's just my comment, Mr.
Okay. I see Councillor Howie, I think Ken, you had your hand up, and I know Mark did as well. So Councillor Howie, we'll go to you next.
Yep, through the mayor. Yeah, no, there's a lot of good points for and against. It's a very hard topic and a lot of points. Luckily, we do have lawyers and senior staff and CAOs to bring the policy forward for us. In making my decision, one of the things I look at, will it save one life? And what do you put the price on of somebody's life if we don't go ahead and do something to try and protect that person? So, and the other thing is it going to back the amount of people going to the hospitals off? Just by doing our little part to try and make sure everybody gets vaccinated. And it just, there's a couple of comments I just wanted to make in regards to that stuff. Thanks.
Okay. Thank you very much. We'll go back to Councillor Allen. Go ahead, Mark.
Thanks, Mayor Taylor. And I guess where I'm coming from is that, with respect to our CO, to Greg's comments regarding the vaccination passport, I believe we're talking about two very different things here. Vaccination passports are required for entry into non-essential locations. It's by choice that people are getting those vaccination passports and entering those rooms when you're those buildings and infrastructure. When you're talking about rationale for people to keep their employment, it's a different thing. And as Councillor Power said, like some people did not maybe expect this to come when there's very many examples of other municipalities and public sector agencies that are using rapid antigen testing as an alternative to vaccination and not for creed or not for medical reasons. So I think in consideration of our staff and those folks that have felt hesitancy for their own reasons in becoming vaccinated, in order to digest that, I don't think the suggestion that Councillor Powers is offering is overly cumbersome to this policy. And let's not confuse it with vaccine passports. It's a different policy. Thank you.
Okay, thank you. Deputy Clerk, go ahead, Bonnie.
Yes, I'm certainly, it's a hard decision. And for those people that, did decide not to, this is their employment, but I am okay with some flexibility around dates. I don't see that as a hard line that I would draw in the sand. And certainly for that flexibility, I would be in agreement of that.
Okay, thank you. I'm going to ask three different councilors a very simple question, and I'm hoping I can just get a very short and simple answer. I'm going to ask Deputy Mayor Clark, Councillor Powers, and Councillor Allen. Deputy Mayor Clark, you're a member of the Peterborough Public Board of Health. Is a mandatory COVID vaccine for workplaces position that's supported by Peterborough Public Health?
Yes, as a board member there, it is for the protection of the public, and that is the policy has been stated here by the province as well as the health, and we have to look at the overall protection. I think Councillor Howie said, will it save one life? Will it save one hospitalization? So I think it's very hard. This is not easy, but we have to look at weigh the good with the bad. And
Okay,
so therefore,
it is supported by Peterborough Public Health.
absolutely, yes, it is.
Councillor Powers, the city of Peterborough, I believe, is discussing this very issue as we speak, or they may be over it at their council meeting tonight. This is something that is, I think, is proposed for the city of Peterborough employment as well. Is that correct?
That is correct. Very, very similar policy is going to the city of Peterborough's council tonight. So yes, they may be talking about it at exactly the same time.
Thank you. And Councillor Allen, is mandatory COVID vaccine now in place for the school boards across the province?
Thanks, Mayor Taylor. Well, to speak of all school boards, I'm not sure that some haven't gone beyond the OPS, the Ontario Public Sector policy. Currently, our current policy locally is within the Ontario Public Sector, which includes, it has a lot of similarities, but like where I keep going from, there is an alternative for rapid antigen testing for those who, for whatever reason, have chosen a different path with vaccine treatment at this time. So, typically attestation, you're vaccinated, you carry on with life. If not, you're doing your test twice a week and reporting those tests. So that's basically how the policy exists.
And thank you. And Greg, I know that the county and township CAOs are in regular communication about a number of issues. How many, and in conversations with the other township CAOs, how many other townships in the county of Peterborough are considering a similar policy for their workplace?
All of the townships are considering a policy, and in some form or fashion, I think, and utilizing the county policy is a bit of a guideline, is where they're going. Okay,
thank you. And it's obvious my reasons for this question is this isn't something that just Otonabee-South Monaghan is doing. This is becoming almost the norm. And it's not just in public sector places of employment. Some private sector and some large private sector places of employment have adopted this policy. It's been supported by several of the large unions. This isn't pleasant. It's not fun. Nobody asked for this, but it's a reality of the world we're living in now. And it's unfortunately, it's going to, I think, become the norm in the very near future for most workplaces. If there is no other questions or comments, I think where I need to start, first of all, is, and I do remember Councillor Allen wants a recorded vote. But I think, and Heather, I'll look to you on this one. First of all, Councillor Powers has suggested that the deadline be extended to November the 6th. So should we have a motion first that the policy include the amended policy be revised so that the deadline for proof of vaccination is November 6th? I see Greg's hand up. Go ahead, Greg.
Just the one item is that November the 6th is a Saturday.
Right.
And so if we're going to do this, and if you want to extend it, you should think about the 5th. And for it not to be, and to be fair with all of our staff, for it to be during a regular work week day.
Yeah, I looked at the calendar, Greg, and I thought, well, if it's the 6th, people can still get vaccinated on the 6th, and then when they show up to work on the 8th, they've got to show that proof. Does that not work?
Mr. Mayor, I would prefer that we would have that date during a regular work week date.
So it could be the 5th or the 8th.
Yes, sir.
Councillor Powers, you're the one who proposed the change. So you tell me, what motion do you want me to put forth for council?
I am fine with the 5th. I can appreciate it wanting to land on a particular work day versus a Saturday. So that's still, if I look at it, it's still, you know, tomorrow is the 28th, the 5th is a full week from there to the 5th. So that gives staff 1 full week to digest, schedule, and attend to their first vaccination. So I am okay with moving forward with the amendment being the 5th and 5th to the policy as presented.
So Heather, I think what I should do is ask for a motion. If council are prepared to approve the policy as amended with the date changed to November 5th. Correct?
Correct, Mr. Mayor.
Okay. Councillor Allen, go ahead, Mark.
Thanks, Mayor Taylor. Thanks for the opportunity. It's a small nuance. I'm not sure if it couldn't be slipped in here if council, if it was so their desire, as far as the review. I just wanted to ask that there was a hard date of an annual review of this policy added to it. I don't think it's huge ask at this time, but it seems like a small one and maybe it'll slip into this motion.
Yeah, I don't think that's a huge ask either. What time frame do you have in mind to propose for council?
Well, I thought an annual review, and that would be based on when the date.
Okay.
And you know, that's a year from now looking out. Hopefully we're in a better position and maybe things have changed in the world.
Okay, Deputy Clerk, go ahead.
Just a question through the mayor and maybe to the CAO. I certainly like it being reviewed annually, but also I think if any circumstances change totally, you know, maybe in the spring we're got rid of this.
Right.
So at some way, minimally, you know, if any changes or annually at least. So I think it's kind of a fluid thing here, but with a firm annually.
Mr. Mayor,
thank you.
I could respond to that. I think item K, which is, the policy updated and amended from time to time in the township's discretion, taking into consideration that legislated obligations, public health recommendations, and business needs. We're trying to give that nuance about us, not like about us reviewing this all the time. So we could be reviewing this in a month, right? So, and I get council's request that says that we should be coming back, if we did have to go out a year. So, but I guess our intention from staff would be for us to bring it back to council as soon as it's not a requirement, right? So we're motivated like everybody else to do that. And that's why I thought K seemed to cover off all of those eventualities, because if there was an issue related to change of legislation, let's say the province tomorrow said that they're going to have a mandatory vaccination policy, we could probably take ours off the books because we're going to be under provincial regulation, right? So that's what that's a couple of examples. So,
and to that point, I think that's exactly right. I mean, if you didn't and council seen fit that there were some huge changes, we're going to bring it and say, bring this
right.
back. So,
yes,
yeah.
yes.
Okay. Well, thank you. Is that Councillor Powers? You had your hand up. Go ahead, Nick.
Yeah, I would generally agree with Councillor Allen that at least have it in there as annually. So I think it's a very simple change. For example, you could simply state this policy will be updated and amended, and the only thing you need to add is annually and. So if you just say this policy will be updated and amended annually and as required from time to time. So there you're covered then.
Yeah, and or, yeah.
Yeah, and or.
Okay.
Well, I think it would be an and, I guess, yeah.
Okay.
But either way, either one.
Right. Okay, so there's a couple of amendments been suggested here, and when I do ask for a motion, I will state those so council is clear on it. One thing I'd like to ask Greg, because Mark brought this up earlier in the conversation and I hadn't thought about it. It's an interesting situation. Is a year from now, pretty close to a year from now, we're in the midst of a municipal election. And there'll be people who put their names on ballots that run for positions in this council. Does this policy suggest that anybody who will be running as a candidate must be vaccinated?
Mr. Mayor, I don't, and I look to the clerk here too, I don't believe that any candidates would be covered, because you would be covered once you're sworn in and you would take the oath as a member of council. I think that that's how I would sort of interpret that. And I look to the clerk to provide a new comment about that.
Sorry, Mayor Taylor. I agree with the CAO, as long as because this policy speaks to council.
Right.
Candidate, they're not a council member at that point in time. So,
okay.
but that would be certainly in the policy when the information goes out to each candidate, that will be a requirement should they take office.
Correct. So that any candidate will have to be potentially advised that should they be successful, before they can be sworn in, they will have to provide proof of vaccination, correct?
Correct.
Okay, interesting. I hadn't thought about that one, but I can see it. I can see it happening. Okay, council, great discussion. Thank you very much. I know that this has been taken seriously, and we all have our opinions on it, rightfully so. But what I'm going to ask council, if they would entertain a motion that the OSM Township Personnel Policy 8.3 mandatory COVID-19 vaccination policy be approved with the amendment to Section K, that the policy will be updated annually or as required and as required from time to time, and that the deadline for proof of vaccination from employees be extended to November the 5th. I think that covers the two changes that council were comfortable with. And so is anybody, before I ask for a vote, I see Greg's hand up. Go ahead, Greg.
I believe that Councillor Powers, and correct me if I'm wrong, Councillor Powers, that you wanted that the dates be October 5th and November the 5th. So both dates be changed.
Okay. Thank you. So the dates for requirement in this policy be October 5th and November 5th. Thank you, Greg. And that's correct, is it, Councillor Powers? Okay. And that the clause be inserted into Section K, that the policy will be updated annually. So is any member of council, and this will be a recorded vote, is any member of council prepared to make that motion? Councillor Powers. Do I have a seconder? Deputy Clerk. Okay, we'll ask for the clerk to call a recorded vote.
Council, in accordance with the procedural bylaw, I'll be calling your names alphabetically, and when I do, please say yes or no. Councillor Allen?
No.
Deputy Mayor Clark?
Yes.
Councillor Howie?
Yes.
Councillor Powers?
Yes.
Mayor Taylor?
Yes.
The vote is, I have 4 yes and 1 no.
Vote's carried. Thank you very much. Thank you to staff. Thank you to council. And thank you for sure to our employees for hopefully understanding and trying to comply. And we're just going to move on. I sure hope the comment that was made earlier that we may not need this in a year. I sure hope that's correct, but it's needed now. Anyway, moving down in the agenda, we're going to move to planning, and our planner has been waiting patiently in the wings. Ken, we'll start off with consent application B7321.
Okay, thank you, Mayor Taylor. The purpose of this application is to create a vacant residential lot. The land is addressed 195 Drummond Line. It's located at the southeast corner of the intersection of Drummond Line and Providence Line. The proposed severed lot is approximately 0.37 hectares with approximately 43 meters of frontage along Providence Line. The proposed severed lot is currently vacant. The proposed retain lot is approximately 2.25 hectares, with approximately 121 meters of frontage along Heritage Line. The retained portion contains a single detached dwelling and a shed. The subject property is zoned rural and environmental protection in the township's comprehensive zoning bylaw. As the proposed severed lot will not meet the minimum frontage and lot area requirements of the rural zone, the zoning bylaw amendment to rezone the severed parcel from the rural zone to the rural residential zone is recommended as a condition of consent. And I believe I stated Heritage Line, there was frontage of Heritage Line, that's incorrect. That is Providence Line.
Okay, I was going to check with you on that one. We are talking about application B73, right?
Yes, that was
Okay.
my mistake. Apologies.
Thank you.
If there are any questions, I'd be happy to answer them.
Any questions from members of council on this particular application? Go ahead, Councillor Powers.
Thanks, Ken. Just a quick question. There is no EP on the severed portion, is there?
No, the severed portion is entirely rural.
Okay. All right. Thank you.
Any other questions? Deputy Clerk, go ahead.
I don't have a question through the mayor. I am prepared. It meets all the requirements. So I'm prepared to make the motion that we approve the creation of a lot with the 3 stated conditions that are listed in our agenda.
Okay, Deputy Clerk has put forth a motion that application B7321 be approved, and the approval will be subject to the 3 conditions listed. Do I have a seconder? I see Councillor Allen. Any discussion on the motion? Seeing none, we'll call the vote. All in favor? That is carried. Thank you very much. Thank you, Ken. Okay, moving down now to an application with frontage on Heritage Line.
That's correct. This is consent application B-60-21. Once again, it's to create a vacant residential lot on the lands addressed 1265 Heritage Line. The proposed severed lot is approximately 0.4 hectares and has approximately 50 meters of frontage along Heritage Line. The proposed severed lot is currently vacant. The proposed retained lot has a lot area of approximately 54.79 hectares and has approximately 515 meters of frontage along Heritage Line. A single detached dwelling, a shed, and agricultural uses exist on the retained lot. The proposed severed lot is zoned rural entirely, and the proposed lot will not meet the lot area or lot frontage provisions of the rural zone. Therefore, it is recommended to rezone the severed lot to rural residential. And further, the proposed retained lands are zoned rural environmental protection. And although the retained lands are compliant with the rural and environmental protection zone, there are non-evaluated wetlands existing on the retained portion of the subject property, and therefore I'm recommending that we rezone that to environmental protection to protect these wetlands from future development. And if there are any questions, I'll be happy to answer them.
Thank you, Ken. And just to clarify for council's information, the original report contained a mistake on the map, and you have corrected that mistake, and the map that's here now is the correct version.
Yes, that is correct. That was for the same property that we discussed at the last meeting.
It looked awfully familiar, Ken. Yes.
Yeah.
All right. Any questions to our planner on application B60? Seeing no questions, is member council prepared to make a decision? Councillor Powers, go ahead.
Move that we approve consent application B60-21 with the 4 conditions as defined. There we go.
Very good. Motion to approve it. Councillor Howie, are you willing to second that? Seconded by Councillor Howie. Discussion on the motion? Call the vote. All in favor? Carried. Thank you very much. Thank you, Ken.
Thank you, everybody.
Thanks, Ken.
Okay, moving down now, we go right through to 17 on the agenda, which is correspondence. 17.1, the City of Sarnia on rental evictions. What is council's decision on this one? Councillor Allen, go ahead.
Sorry couldn't find my mouse for a minute. To receive.
Motion to receive by Councillor Allen. Do we have a seconder? Deputy Mayor Clark's going to second that. Call the vote. All in favor? Hands high, please. Okay, that motion is carried. Thank you very much. 17.2, Township of Scugog with structure inventory and inspections. Deputy Mayor Clerk, go ahead.
Motion to support.
Support, seconded by Councillor Powers. All in favor? That is supported. Thank you very much. That's all for the correspondence package. Information, strictly information only, has the results of the deployment of the Black Cat on Assumption Road as requested. And you can see the information there. Certainly it's actually surprising that 85% of the vehicles travel at a rate less than the posted speed. I wish all roads could say that. Is there any discussion or on this one? Go ahead, Deputy Clerk.
Totally in shock of the results.
Yeah. Go ahead, Councillor Powers.
Yeah, as someone who travels that road almost daily, I am also shocked at those results. That not only was my calculation, not only is 85% below the posted speed limit, 85% are below 70 or below kilometers per hour on an 80 road. I mean, that's impressive. So.
Well, let me make sure I'm not misunderstanding anything. While we may be shocked at the results, we're not questioning them, are we? No? Okay.
No,
good.
no, I have trust in the Black Cat system,
Okay,
absolutely.
good.
Yeah.
Thank you. Councillor Allen, did you have your hand up, Mark?
I did, but I'll finish on another note. I was going to offer a motion to adjourn just as this was finishing up.
I'll be with you shortly.
All right.
Deputy Mayor Clerk?
Just a question around Black Cats. And I don't know who this goes through to, but I would like to do a Black Cat speed for, I guess it should maybe be the county though, Joe, because going through Keene, they're both county roads. So I take that back. I take that.
We have requested the Black Cat be used on County Road 2 west of Keene already. In fact, it may be there now. And we've also requested it be used at Mather's Corners. Even though they're county roads, it's our Black Cat device and we can use it anywhere in the county that we like.
Can we also do Indian River?
Certainly.
Okay.
Yeah,
I just think all our settlement areas that this information I think is great to have.
So what we need though is if a member of council has a particular location that they have been advised could be troublesome, we need an address. And the OPP, when it's convenient, and can deploy the Black Cat as close to that location as is practical. Okay, so if you've got a particular place in Indian River that you're interested in, we can't just go around and helter-skelter put this thing up wherever we want. But if there's a reason to try to compile data, if there's concerns at a particular area, then advise the clerk. You can advise me as a member of the Police Services Board, although that's in limbo right now, but advise the clerk is the best way to do it. And Heather can coordinate that with the OPP.
Okay, no, I do have an address of an individual, so
Okay.
absolutely.
You can share that. Anything else from members of council? Going over to Councillor Allen, motion to adjourn. Seconded by Deputy Mayor Clark. We are adjourned. Thank you, council. That was a good discussion. You know what? I'm pleased with how council handled themselves this meeting. It was not easy, but we got through it. So thank you.